Atrial fibrillation is the most common type of arrhythmia, and if left untreated, it can cause chest pain or even heart failure. In this week's CHI St. Vincent report, we look at one way to treat the condition.
Sometimes you'll have shortness of breath, and you feel like your heart's going to jump out of your chest a little bit because it's beating in a manner that's not normal.
Carl Packer suffered from atrial fibrillation for years.
You can't be as active as you normally are.
It was taking a toll on his life, so he came to CHI St. Vincent.
I was a good candidate for the mini-maze, and I thought about it, and we talked about it and how they do it, and it took a few weeks to think about it, or a couple of weeks, I think, with my wife, and was blessed to be hooked up with Dr. Rayburn.
What we're predominantly seeing are people that have very difficult atrial fibrillation to treat, where almost certainly, and Mr. Packer is a perfect example of this, he's failed multiple drug therapies. He has some factors in there that lower his risk with a catheter ablation of being able to be free of his atrial fibrillation.
Dr.Tom Rayburn says their integrated center for treatment of atrial fibrillation includes cardiovascular surgeons, cardiologists, and electrophysiologists working together to treat the condition.
What we've been able to do is to use port access surgery on the beating heart through keyholes and operating off television cameras, and being able to ablate his atrial fibrillation and put him back into good rhythm.
Along with the surgery, Packer changed his diet and lost almost 150 pounds. He says he's glad he got